Good morning. My name is Kate Fry, and I'm the Vice President of Advocacy at New Futures, a nonprofit, nonpartisan organization that works to improve the health and wellness of New Hampshire residents through policy change. Prevention, treatment, and recovery from substance use disorder has been the cornerstone of New Futures advocacy efforts since the organization's inception in the late 90s. Our organization continues to prioritize the issue, ensuring that the state has resources needed to sustain the full continuum of care for this disease that has affected so many individuals and families in our state. We also understand that general funds are limited, so that is why New Future stakeholders and legislators champion an innovative, fiscally responsible approach to funding substance use disorder programs in the state. The intent behind the creation of the Alcohol Abuse Prevention and Treatment Fund, also known as the Alcohol Fund, through law in 2003 was to direct 5% of gross profits of the very substantial revenues raised from alcohol sales in New Hampshire to substance use disorder prevention, treatment, and recovery issues. For the 26 and 27 budget years, 5% of gross profits are estimated at $10.7 million. A drop in the bucket compared to the $757 million in revenue raised through liquor sales in New Hampshire in 2023. The ask to policymakers for the budget regarding the Alcohol Fund is simple. Utilize the Alcohol Fund for the intended purpose of supporting contracted prevention, treatment, and recovery programs, and continue to fund the Alcohol Fund with 5% of liquor gross profits in 26 and 27 at the $10.7 million level. While Governor Ayotte's budget committed to these principles, the House budget fell short. The budget writers chose not to utilize liquor revenue as originally intended by law, and instead this revenue line will shift from liquor revenue to Opiate Abatement Trust Fund, which will also require the cancellation of all opiate abatement contracts beyond May 2025. While New Futures understands the challenges of this budget year, this proposal essentially eliminates $10.7 million in non-general funding to the entire system. At the same time, it's facing a loss of $1 million in federal funding. The Alcohol Fund supports hundreds of prevention, treatment, and recovery programs administered through the Governor's Commission on Alcohol and Other Drugs without tying up valuable state general funds. And the proposed shifts in how the governor's programming is funded eliminates the state's ability to meet the needs of citizens struggling with alcohol, stimulants, and other non-opiate substances. More than half of the Governor's Commission contracts support non-opiate prevention, treatment, and recovery services. We often get asked, what do these dollars fund? Why is this so important? You will hear today from the quiet warriors doing the work every day and those whose lives have been devastated by alcohol use disorder. We really thank our speakers for being here today to share their stories and concerns about this proposal. And have each speaker introduce each speaker and have them say their comments, and then we'll open it up a little bit for questions. So with me today is Cheryl Pacapelli, the program director for Harbor Care, and you'll be speaking about recovery efforts.
I will. Thanks, Kate. So, good morning, and thank you all for the opportunity for me to speak today. My name is Cheryl Pacapelli, and I am a person in long-term recovery for over 35 years. I'm the project director at Harbor Care, and I'm here to speak on behalf of thousands of Granite Staters whose lives have been impacted, in many cases transformed, by the life-saving work made possible through the Governor's Commission on Alcohol and Other Drugs and the New Hampshire Opioid Abatement Trust Fund. Today, I want to make one thing clear. Fully funding the Alcohol Fund and maintaining our current Opioid Abatement Trust Fund contracts is not only fiscally responsible, it's a moral imperative. Recent proposals to shift how the Governor's Commission is funded would undermine the very foundation of our public health response to substance use. More than half of the Commission's current contracts support prevention, treatment, and recovery service, for non-opioid substances like alcohol, stimulants, and methamphetamine, which are surging in use. Cutting or altering funds puts thousands of people at risk. We cannot afford to build a siloed response to a multifaceted crisis. Organizations like Harbor Care demonstrate what's possible when the state invests wisely and strategically. In 2023 alone, Harbor Care supported more than 5,000 individuals and families, connecting them with safe housing, medical, and behavioral health care, substance use treatment, employment services, and much more. That's what a well-funded, integrated system looks like. A cornerstone of this system is the Peer Recovery Support Services Facilitating Organization. It's a big title, but we call it PRSSFO, and it's administered by Harbor Care. Over the past 7 years, this contract has enabled the growth of a robust network of 10 recovery community organizations operating 21 recovery community centers across New Hampshire. These organizations are not just service providers. They are lifelines for people using substances, seeking recovery, or working every day to sustain it. The peer recovery model works, and its outcomes speak for themselves. It's cost-effective, community-driven, and nationally recognized. Harbor Care provides essential technical assistance, compliance oversight, quality training, and ensures that all centers uphold high standards of care. Thanks to the support of New Hampshire's peer recovery support systems model, a model for the nation, one that other states look to when building their own recovery infrastructures. To disrupt this system now would be to squander 7 years of investment, collaboration, and innovation. It would risk destabilizing services that are life-saving and restoring families, not just from opiate use, but from a broad range of substance use challenges. We urge everyone, our leaders, to fully fund the alcohol fund, to protect the FO contract, and continue investing in a model that works, not just in theory, but in practice, every day across our towns and cities. New Hampshire has built something extraordinary. Now, we must have the courage and the foresight to protect it. Thank you for the opportunity.
Thanks, Cheryl. Yeah, I'm listening to your comments. I'm so reminded of the progress we've made over the years. And my next speaker is Celeste Clark from Raymond Coalition for Youth, an amazing prevention organization out of Raymond, Celeste is one of these people who really totally understands the prevention infrastructure in our state, and I'm so grateful for that.
Thank you so much, Kate, for inviting me here to be with you this morning to talk about the value of prevention. As you mentioned, I'm Celeste Clark, the director of the Raymond Coalition for Youth, and we've been around for a little over 20 years. Coalition work is really about bringing our resources together to make great things happen, but also to work with those resources to fill the needs and gaps in our community. The alcohol funding that we receive in our community supports the Student Assistance Program, an evidence-based program that works. We have student assistance counselors at our middle school and our high school, and we work directly with them to bridge that gap between community and school. So if our community is looking for help for our students, we can direct them to the student counselor at the school. Our student counselors are able to meet students where they are at and address the needs in the building to provide the appropriate group work, such as newcomers groups, but also it can go over to if students are experiencing loved ones who are struggling with substance misuse and alcohol use. They can have groups for those students to know that they're not alone in the building, that others are experiencing the same thing that they are experiencing. They also offer prevention programming to to stop anything from happening. That's what prevention is all about. So they educate the students on the dangers and risks of starting vaping or starting alcohol use. And it also forms trusting adult relationships. So if a student is experiencing some troubles, they know where they can go to and they can talk to somebody confidentially. For the community point of view, the Student Assistance Program offers confidential opportunity for if I'm concerned about my neighbor's child or my son or daughter's friends experiencing something with substance use. They can come to the coalition and confidentially we can go to the school and we can refer to that counselor. And there's never a backtrack for anyone getting into trouble or feeling like they did something wrong. We encourage that opportunity for them to ask for help for the students. These are a priceless, very valuable resource that we have in the school. We've had, Cheryl spoke about the building this. We've built this program into our school, and without the funding of the alcohol fund, this would go away. We wouldn't be able to have our student assistance program, something that our students have valued. It takes a long time to build trust for young people, but also for the people in the building to know where they can go. If someone's coming and going, that trust is not there. So the student assistance program and the counselors build that in the community, and that helps to foster prevention, which is so vitally important to stop addiction before it can even happen. So we would ask that you fully fund the alcohol fund so we can continue this program in our communities across the state of New Hampshire.
Thank you, Celeste. So now we're going to talk a little bit about the treatment aspects and why the alcohol fund dollars are so important. I'm going to start with Corey Gately, who's an MLADAC at the Laconia. She's the Laconia Doorway Director.
Thank you. Thanks so much for the opportunity today to be here and speak a little bit about this, specifically from the doorway perspective. So as she said, my name is Corey Gately. I'm an MLADAC, so Master's Licensed Alcohol and Drug Counselor. I've worked in the field for upwards of about 25 years, and I am the director of the Laconia Doorway. I also have the opportunity to oversee a medication-assisted treatment program through our hospital. And so when I think about the doorway system, one of the things that I would want to emphasize is that the doorways were originally put in place with SOAR funding, so state opioid response funding. And so our main goal was to treat the opioid epidemic. And it very quickly became apparent that we were dealing with much more than just opioids. And so our task then became to widen our net a little bit. And we were given the opportunity with SOAR funds to also treat stimulant use disorder. But we do lack the ability to use our SOAR funding to help someone with alcohol use disorder. And so we have a fund called our Unmet Needs Fund, which allows us to then help someone with alcohol use disorder. And this would potentially be very affected by these cuts. And I think one of the things that I would really want to emphasize, I looked at our numbers just at the Laconia Doorway, which is only one of 9 doorways throughout the state, over the last 3 months, and we had upwards of 25% of our phone calls and people that we were helping were alcohol use disorder. So it's a fairly high number when you think about the numbers that we're treating. And I think one of the things that we've tried to emphasize in our state through 211 is that if you need help, call, right? If you need help, call. So we have all kinds of people calling without the understanding of what the restrictions are of our funding. And I think that's a super important thing that we've done, is allowed people to simply call for help. And we would not ever want to say, you called and you have alcohol use disorder, so now we can't help you. So we have a lot more people calling for help, a lot more people seeking services. We do have limited funding in our area for alcohol services as well, and what little we have would probably be disrupted if these funds get cut. In addition, I would also emphasize that lots of the doorways throughout the state rely on harbor care and our connection to our recovery coaches. It's been a vital piece of what we do, is put recovery coaches in emergency rooms and in our doorways to help people first. Peer recovery support is really where we should be starting with folks, and I think that would be greatly impacted by this. So I would emphasize that alcohol use disorder for us anecdotally has been on the rise for years, and we are seeing more and more folks that are struggling with alcohol use disorder, and cutting these funds would certainly affect the Doorway's ability to treat people and move them on to treatment. So I appreciate the opportunity to talk a little bit about the Doorway system and how we're able to help people, and what that would look like if we had any cuts to that.
Thank you.
Thank you.
That was really helpful. And then we're going to move on to Beth Odell. She has many initials next to her name. I won't read them all, but she is the clinical director from Hope on Haven Hill. And we're just really so pleased to have you today.
Thank you. Good morning, and thank you for the opportunity to speak. As introduced, my name is Beth Odell, and I'm the clinical director of Hope on Haven Hill. Hope on Haven Hill is a substance use treatment facility that specializes in the care of pregnant, postpartum, and parenting women, some of our most vulnerable members of our community. We can provide care to these women regardless of their ability to pay, whether they have Medicaid, Medicare, private insurance, or no insurance at all, largely because of our contracts with the state, which are funded through the Alcohol Fund. I'm here today to express concern and opposition about the proposal to shift alcohol funds away from the Governor's Commission and the proposed use of opioid abatement trust fund dollars to backfill the money invested in critical prevention, treatment, and recovery services. While it's critical to continue to address the opioid crisis, eliminating the alcohol fund would undermine the continuum of care we have built and jeopardized the contracts that allow us to serve women who might otherwise be ineligible for treatment. Alcohol use disorder remains a prevalent substance use disorder in New Hampshire. A significant portion of clients in our treatment programs, including those at Hope on Haven Hill, present with co-occurring alcohol use disorders, often exceeding the prevalence of opioid use disorders. In the last year, Hope on Haven Hill provided treatment services to 225 women. 56, approximately 25%, had an identified alcohol use disorder, and 144, or approximately 64%, were diagnosed with a substance use disorder other than opioid use disorder. Removing this dedicated funding source would dismantle vital services that support thousands of New Hampshire residents across prevention, treatment, and recovery. For example, one mother with alcohol use disorder was released from prison to receive residential care with us. Because she has Medicare, her treatment was funded through a BDAS-supported contract made possible by the Alcohol Fund. She successfully completed treatment and reunited with her child, who began thriving in her care. Another mother with Medicare who fled sex trafficking and had cocaine use disorder accessed outpatient treatment with us through the same funding. She is now in remission and rebuilding relationships with her two youngest children after years of separation. Without the support of the Alcohol Fund that underpins these contracts, these women's paths to safety, recovery, and reunification with their children may not have been possible. The Alcohol Fund offers flexibility to treat a broad range of substance use disorders, including co-occurring conditions and polysubstance use, issues that are especially common among pregnant and parenting women. These clients often need specialized integrated care that opioid-specific funds cannot cover. By contrast, the Opioid Abatement Fund is legally restricted. It cannot be used for alcohol-related services, youth prevention, or for treating methamphetamine or cannabis use. Relying solely on opioid dollars creates dangerous gaps, leaving too many behind. At a time when demand is growing, programs cannot absorb further strain, especially with continued uncertainty in federal funding and a proposed 3% cut to Medicaid reimbursements. In short, replacing the Alcohol Fund would be a step backward. We need both funds working in tandem, not one at the expense of the other, to ensure that all Granite Staters have access to the care that they need. Thank you.
Thank you so much. Thank you for those examples too. That's very moving. We're very thankful for the work you've done at Hope on Haven Hill. Lastly, we have Marie Kiley, who is a parent who lost her son Ben to alcohol use disorder last year. Thank you, Marie, for being here.
Hello, everyone. My name's Marie Kiley, and thank you for inviting me to speak here today. My son and only child, Ben, died from alcohol use disorder 18 months ago after voluntarily attending inpatient and outpatient rehabs 4 times in the 6 years before his death. He was just 44 years old. Ben appeared so healthy. I never saw him drink. He never had any legal or other alcohol-related problems. He was the joy of my life, and this coming Monday is his birthday. He would have been 46, day after Mother's Day. And I'm here because I hope to see the New Hampshire Alcohol Fund fully funded and dedicated to prevention, education, and treatment of alcohol use disorder. This will not be possible with just opioid abatement funds. Only those with opioid use disorder will have access to the resources if that happens. Alcohol is legal and so socially acceptable that the problem is easy to hide. And families often don't find out about a loved one's struggles until they are seriously ill, which is what happened with my family. I believe my son would be alive today if he had received evidence-based treatment, which we weren't even aware of. Unfortunately, he did not. In fact, fewer than 2% of people with alcohol use disorder receive the proven effective medication-assisted treatment, and fewer than 10% receive any treatment at all. And if funding for alcohol treatment is eliminated, this problem will only worsen. A second contributing factor to my son's death was the outdated stigma-based advice my family received from therapists and rehab staff to limit assistance and support to my son when he needed it the most. Families and friends are naturally desperate to help their loved ones with alcohol use disorder and need to be educated that compassionate support is shown to aid recovery, not hurt it. And my grief is compounded by the knowledge that I could have helped my son if only the education and support around recovery had been available. The Alcohol Fund has the potential to provide much-needed education to the public and providers about alcohol use disorder to reduce stigma and inform them about best practices and science-based approaches. This information can provide hope and knowledge of what effective treatment and support are and how to find them. Loss of funding for alcohol prevention, education, and treatment will worsen an already growing public health problem. Alcohol is the most widely used drug and kills more people in New Hampshire and nationally than overdoses, and these deaths are increasing. And we heard that from a few of the other speakers. Many people do not realize that people can and do die young from alcohol. Greater than 10% of the population over age 12 have alcohol use disorder. And resources are already scarce, and this was a roadblock for my son, who was so highly motivated to recover, and also a roadblock for my actively involved family. I have a master's degree and spent my career in public health, and I never found the resources that we needed to help us and him. How is the general public going to find them without dedicated funding to alcohol education and recovery? So I'm asking that the Alcohol Fund be fully funded also. Thank you.
Thank you, Maureen. I can't think of a better way to honor your son on his birthday than the advocacy you've done this last year has just been wonderful.
Thanks.
It's hard to pivot after that one. So a couple things struck me as we were talking today, and I think it's come up a few times now that the trick here is by supplanting the Governor's Commission work that's funded by liquor revenue and using opiate abatement funds, is that we really run into kind of first of all, a legal issue, that we understand that these are highly litigated funds that have come out of long discussions regarding with the opiate manufacturers to ensure that the funds go to opiate abatement only. And we're also seeing kind of a national trend of some of these funds being supplanted elsewhere. So if this is the case and we move in that direction, and this is probably an impossible question, so I do your best, but I'm thinking with Corey and Beth, if how would the entryway system look different if someone comes through your door or enters your organization with an alcohol use disorder, and it's very clear that we have to limit to opiate abatement funds? What would that look like? And can you even express how that might look?
It would look pretty scary, honestly, and we might not even be able to provide them services, especially if they're uninsured or if they have Medicare. Many treatment programs across the state can't fund those clients independently, and we would have to rely on insurance reimbursement or provide services for free, which, knowing as a Hope on Haven Hill, we would leave no woman behind, and we would absolutely do that if it's what it came to it, and we would fundraise to support their treatment that they need. But yeah, it would be really scary to see this funding go away or be restricted to opioid abatement funds.
I would echo that and say that I think we've worked really hard to find a way to make sure that the people of New Hampshire know that there's no wrong door.
Exactly.
And just come and ask for help. There's no wrong door. And immediately we would be saying, oh, sorry, wrong door. We can't help. And it feels very harsh to say that we wouldn't be able to help, but we already struggle with this population and we're already scrambling to find ways. And yet we do that very cleverly, and I think we do make it happen for the most part. But it feels very scary to me to think that we would be saying, I'm sorry, we simply cannot help you.
And I guess it would go unsaid too, there'd be tremendous amount of pre-work that needed to be done to even visualize how this would happen. Go ahead, Cheryl.
Yeah, and when we look at the recovery community centers across the state and the impact of losing Governor's Commission funds for that, we would anticipate that of the 21 recovery centers, less than 10 would remain open if those funds were gone. So that is will be a huge impact also.
So one of the things I was thinking about in your comments, taking us back in time a little bit,
Right.
10 years ago, can you describe a little bit about what the recovery infrastructure was like here, if there was any at all, and how far we've come?
Yeah, so that it's like amazing when I have to sit down and write about it, because I came to New Hampshire in 2014 and worked for New Futures, and then in 2015 went to Harbor Care, and we were going to try to build this network of recovery community centers. I see Jess over there, she's one of the first ones that got funded, and there literally were no recovery community centers in New Hampshire. And the people who were trying to open recovery community centers were just like people who saw people dying, because now we're in 2015, and people in recovery knew there was an opiate epidemic, but like the world started talking about it then, and so there was a lot of things that came together right at that time to allow this network to be built. But literally the organizations we worked with in the beginning, they didn't even own a pen. Like they had no computers, no desks, they had nothing, and but they were just a bunch of people in recovery, parents of people in recovery, parents of people struggling that wanted to do something. And through a lot of work and advocacy, we were able to, over the last 7 years, build this infrastructure that now has 21 recovery community centers across the state, doing all kinds of services, serving over 100,000 people a year that come into all our doors. So, and it's a national model, because what we did, how we built it here with Harbor Care, kind of the backbone to all of it. So Harbor Care provides any kind of support any one of the RCOs need. So whether they need invoicing support, technical assistance, organizational structure, training, like we have a a la carte menu that they can get from us. And one of the things we did is Harbor Care bought the EHR, the electronic health record, and allowed all the recovery centers to collect data in the same way. Really consistent. We spent a lot of time on making sure it's valid, and so currently New Hampshire, our little state of 1.2 million people, has the best data on peer recovery supports in the entire country. And we are constantly looked at for what that data has, for Medicaid reimbursement, for alternative payment models. We can show clearly that our services help people to
And it
recover.
sounds like the alcohol fund dollars has allowed you to leverage other funds.
Oh, my God.
To just expand to this. Yeah,
Yeah.
it's amazing.
The
It's a great
alcohol
example.
fund was the beginning of it all that we built everything off of. We got SOAR dollars for a while. We got STR. Remember what that was called? Something. STR was before SOAR. Yeah.
I think that's a perfect example of how the alcohol funds are so flexible. There are no constraints around them, that they can be used for what is needed at the time. I think we're all used to working with Band-Aids and holding things together, and then leverage these funds.
Yeah, and you're right, because it built the infrastructure for the recovery centers to go out to get other funding. Like they might get a Department of Education grant for $50,000 that doesn't let you pay for rent or internet or anything, just a staff person. So the Governor's Commission allows for all that infrastructure to be paid for.
So Celeste, one thing I was thinking about when you were speaking in prevention, is how there are just these prevention coalitions in our communities. Thank God for the work they do. They really dig into the youth risk behavior survey to understand what's going on in their communities. And I'm wondering if you can speak a little bit to, I just remember in 2017, one of our community engagement coordinators came back and said, are we doing anything on vaping? Because people are, and well, we will do it now because it's such an issue. So can you talk a lot about how it was really a matter of having to pivot based on, the substance use disorder, or really the industry that are targeting youth, and how you handle situations like that, and how the alcohol fund has allowed you to do that?
Yes, so the Youth Risk Behavior Survey is so vital to all of our prevention work because it tells the story, right? And then our programming is all data-driven. And absolutely correct. So cigarettes were an issue 20 years ago, and we did a fantastic job of dropping that down through education and awareness and prevention activities at all age levels. And then the vaping industry came along, and they started targeting our kids with the fruity flavors and discreet little device that you could use it with. So we started collecting that data, and we saw we're at about 16% of our youth report vaping now, where tobacco is at like 4%, I think. It's pretty low. But the vaping industry, if you talk to any prevention person or any school, it is so bad right now. And the work that we do specifically with our student assistance counselors, they're doing programming around this, but it's as young as 4th grade now in our community. And not just our community, all communities are, depending on what your middle school age range is. If it's in the building, kids are experimenting with it. And we're collaboratively working across our partners with the police department and liquor enforcement, tobacco. So all of those things that are in danger, prevention really needs a voice right now, because our kids are experiencing the devastation that comes with these substances, that we don't want them to get to these levels of all of the other services that are needed. And prevention is so much more cost effective when we think of how expensive treatment can be for an individual. So the alcohol fund funding the student assistance program really helps us to meet it and stop it before it even happens. And that's why it's so vitally important to continue these programs.
A couple things that you mentioned. One other program funded by the Alcohol Fund is the Partnership for New Hampshire, which really provides a tremendous resource on all substance use prevention efforts. And as a parent, if you have a question about a substance or something you're concerned about, you can find the answers there, as can teachers and SAPs. And so I think it's great that the prevention community has something that they can rely on with the most accurate information.
Yes.
And I will say, you are absolutely right. If we lose the tobacco control cessation program, our kids won't have a quit line anymore to help the 20% of kids who vape right now, 11% who are looking for help. We will no longer have that resource. And if we lose liquor enforcement positions at the New Hampshire Liquor Commission, we won't be able to do compliance checks.
Exactly.
for tobacco and alcohol. So there are a lot of things in this budget we're
Yes,
concerned about.
Exactly, and they're all interconnected when you think about prevention. We use all of those things, and thank you for bringing up the partnership, because all of the coalitions and the schools do use that for effective messaging to get it out to the community.
Accurate, up-to-date information. So Marie, when you were speaking, it really struck me that when you talked about stigma, and for years we've talked about stigma, and I think everyone here today can speak to that. What do you find that's maybe lacking around the work we're doing, and where can we move forward as far as addressing the stigma, particularly around alcohol use disorder, and also the challenges that we're facing that we hear all the time about the opiate epidemic, but all along we've had this quiet killer with alcohol use. So what's your reflection as a parent who's gone through this horrific tragedy? What do you see on the other side of how we can do better?
Well, good question. So I wonder now why it is after he died that I have met so many people, like the people here and like the others that I'm working with at Boston Medical Center, who are aware of alcohol use disorder, that it's a medical condition, just like cancer and heart disease and diabetes. It's a chronic relapsing condition, that relapse is not failure. There's effective treatment available. That family support is so important. So I don't know why I couldn't find this before, and I was looking. So when I think about it, I think that my son spent a lot of time in hospitals. He was multiple hospitalizations in that last 6 years before he died, and I was always there. And I think when he was in the emergency department, if the hospitals, if the staff had talked to me, and he always gave permission to talk to me too. I think if the hospital staff had talked to me and to him, that he could die. That I never imagined somebody as young and healthy as Ben could die. So if providers had talked to me about that he could die, that there was effective treatment available, had they referred him to programs that were practicing evidence-based treatment. The social workers also, because I was always involved with the social workers, and they did not refer him to programs with evidence-based treatment. And if they had talked about stigma, I mean, stigma, I guess, you know, from what I've learned, it affects how the providers see treatment approaches. So I think that there's a lot of education about stigma that needs to go out to the providers. We talk to therapists, to LADACs, and to the family liaisons at the rehabs. And it was all of that stigma-based tough love and hitting bottom stuff. So I think there's so much education needed of the providers in hospitals, the social workers, the therapists, the LADACs, and then also the public, just educating the public about that. So when they hear it, because everyone just about knows somebody who's struggling with alcohol use disorder, so when they hear that, they understand that don't listen to that. It's important that you do support them where you can. People have to decide for themselves how that is, because everyone has a different story, but that it's important to support them, that they need that. And it's intuitive. I mean, everyone wants to help their loved ones, and you know, to be told that you shouldn't, just that's all I heard. And it had an effect. So, I mean, we didn't make him go sleep in his car like they told us, but it affected, you know, I could have helped him a lot. There's so much I could have done. I could have helped him pay those co-pays for his treatment centers. There's so much I could have done to help him that would have relieved the stress, would have let him know that he had the support of his family that he needed. So I just think, like I said, education of the public would be a big start in helping people, so that they know that there's hope available, that there's treatment available, and that support, they can support their loved one. So really a lot of education.
Yeah. It sounds like, I mean, that word hope is so important, you know, and it, even though, you know, the Governor's Commission work does fund some of the issues raised around stigma, around the Foundations for Healthy Community does work within the hospitals to educate more on this stigma with alcohol use disorder, funds family supports. We have a long way to go, and now is not the time to turn our backs on people who are struggling with alcohol use disorder or any other substance use disorder. So Thank you. Well, I want to thank all our panelists. I just want to wrap up by saying the proposed elimination of that $10.7 million of alcohol funds, as you learned today, will hamper all our collective efforts to combat addiction to alcohol and other drugs. And it really threatens a successful and innovative structure that you all heard today. The doorways, the peer recovery supports, the critical services, the student assistance programs, and addressing that stigma. So we've made tremendous strides. This terrible impact of fatalities and this disease that has destroyed lives and families. So now is not the time to turn our back those struggling with the disease. And we ask the Senate to continue to fund the alcohol fund with 5% of local gross profits in 26 and 27 in the proposed governor's budget. Thank you all for being here today, and thank you again to our panelists. We really